listeners, my name is Ofentse Nong, and on today's episode of Unscripted, we have two amazing occupational therapists by the names Melissa van Rensburg and Vanessa Manyoka. And they are both occupational therapists who will be here raising awareness about occupational therapy. Good day, ladies. How are you guys doing?
I'm good, thank you.
Very well, thank you. And you?
I'm good. So, I'm going to start with you, Vanessa. So, most of us don't know what occupational therapy is. So, do you mind telling us what is occupational therapy and what kinds of conditions do you typically treat?
So occupational therapy is basically, we would like to say it as client-centered. So we would like to work more with what the client wants to achieve, what the clients want to do. So we try and work with patients who are struggling physically, mentally, or have environmental restraints or constraints to help them go back into independently doing what they initially do. So like everyday activities like your dressing, your feeding, your getting in and out of bed, transferring onto a toilet that if you find yourself incapacitated and unable to like walk. We also work with mental health, where we try and work with working with leisure activity, working with life skills, social skills, helping them integrate back into society. Because with mental health, most of the time we find that there's a lot of stigma around it. So we like to teach them those skills to try and reintegrate them back into society. So we also try and get them into adapting the environment however way possible we can, giving them assistive devices, strategies that they can use to help them better engage in their everyday activities in a more independent way.
Okay, so Melissa, for you, I would like to know what are the roles of an OT and like how would you say that you help patients with it and
Alright, so I think it adds on to what Vanessa was saying about independence. That is the focus of our job. So whenever a patient is incapacitated, have any injuries or illnesses, we help them to become independent again. So that is the major benefit. So for example, a patient with amputations, we help them to be mobile in a wheelchair, to go to the toilet, to dress, to continue their life independently. So the roles that we have within this hospital specifically, we work in surgical and orthopedic wards. So that is your amputations, your spinal cord injuries. We see a lot of wheelchair patients there. We teach them how to use the wheelchair, how to be independent. Then we also work in neurology. So we see strokes, we see traumatic brain injuries. We help with orientation, with memory, cognition, also with functional activities. A lot of times the stroke patients are unable to use their arms, especially the one side, so then we would help them to dress with one hand, eat with one hand, and be independent when they go back home. We also work in pediatrics, where we see quite a variety of patients. We see patients with physical injuries like fractures or also spinal cord injuries, but then also a lot of neuro conditions. So your CP, your autism, and a lot of school assessments, children struggling in school. And then the last one is mental health, like Vanessa mentioned. So in psychiatry, we especially work in the acute ward here at Biko, where we run psychomotor groups, we run life skills group, we teach them skills to go back into the community and integrate there. And also in terms of work. So if it's a psych patient or physical neuro, we do a work assessment and see how we can assist them to go back to work despite the injuries.
Okay, so back to you, Vanessa. So what other things or roles do you play outside of hospitals or health facilities?
So basically, we're not only based in hospitals. We get to have the opportunity to work in schools, sheltered employment facilities, as well as industrial situations. Sometimes kids struggle with grasping. We get to help them with grasping the pencils. We also work with cutting of scissors, as well as letter formation as well. So there's this thing where sometimes kids get to write from the right to the left, or the left to the right. So we get to work with that and help them in that specific way, as well as if there's letter reversals, instead of a B, they write a D, or instead of a P, they write a Q. So we get to teach them how to do all that. So that's mostly where we can also work outside of the hospital.
Okay, so lastly, Melissa, what awareness would you like for people to know about occupational therapy, whether the general public or the healthcare industry?
So in general, we would like to especially educate healthcare professionals to know what the role of occupational therapy is and when they need to refer a patient to us so that we can assist the patients that need that. And then also in public, just so that patients that are referred to us will know what to expect and what is happening when we go to see them. So next week is Occupational Therapy Awareness Week. We are also running an event here in the hospital Friday afternoon from 12 until 1. It's going to be here on level 3 in the atrium, where we are going to display a little bit about what OT is. We will show wheelchairs and splints and some of the neuro stuff, some of the psych stuff, just to educate the public and both healthcare professionals. So